Hello, everyone out there. Thank you so much, and I welcome you to this presentation on TB preventive therapy, which in our country we use isoniazid. So we'll be focusing so much on isoniazid prevention therapy. I am Louis Ochen, and this will be our brief outline of what the presentation will be about. We'll be looking at the background, the involvement of IPT in the country, how does it benefit our clients, which of our clients are eligible and who do not qualify, how to dispense and dose, the common side effects we anticipate and how to manage them, the ordering, reporting, and the next steps. The Ministry of Health has 4 interventions or prongs which target TB prevention among PLHIV. The first one is the use of intensified case finding guide and having all TB HIV clients identified and put on treatment. Isoniazid preventive therapy is the second prong, a 6-month course of isoniazid. Then we have infection control for TB, early initiation for ART or early initiation of ART among the people living with HIV also helps in TB prevention. What are some of the benefits of IPT? First and foremost, it prevents the progression of TB infection to active TB disease. Most of our clients are already infected with TB, but as their immunity lowers, the TB infection turns out into TB disease. IPT also helps to reduce any TB-related deaths and sicknesses among the people living with HIV. Who qualifies for IPT? According to our program, all people living with HIV who are 1 year and above with a negative TB symptom screen should be offered IPT for 6 months. A negative TB symptom screen means they have no signs and symptoms of TB as per the ICF guide. PLHIV who have also successfully completed their treatment of TB should receive IPT immediately when they complete their treatment for TB. Then for children who are living with HIV but less than a year, they should have had a history of contact with someone with active TB. And additionally, they should also be without any signs and symptoms. They should be having a negative symptom screen. Then for children under 5, irrespective of their TB status, irrespective of their HIV status, when they get into contact with anyone who is bacteriologically confirmed, they require a 6-month course of IPT. So to note, IPT among PLHI, those who are HIV negative, is only for children below 5 years of age, the under 5 contacts. Who should not take IPT? What are the contraindications for IPT? The first, any person with a sign or symptom suggestive of TB doesn't qualify. Patients who have active TB disease or are already on treatment do not qualify for IPT. Contacts of MDR TB, multi-drug resistant TB patients, or a formerly MDR patient who was treated and cured does not qualify for IPT. Children living with HIV who are less than 12 months of age without a history of contact with a TB case do not qualify as well. Now, if someone has a non-allergy to isoniazid with symptoms like difficulty in breathing or reported swelling of lips, tongue, or face, they don't qualify as well. Chronic liver disease, hepatitis, with those complaints of the right upper quadrant pain, dark urine, pale stools, patients that are alcohol dependent, with a history of mental illness including epileptic convulsions, and anyone with peripheral neuropathy. Before starting INH, burning sensations or pins and needles do not qualify as well for IPT. So in brief, those are the people who do not qualify and should not be initiated on INH. Let's have a brief look at how INH is dispensed. It comes into two to three formulations. There are 100 milligram tabs, majorly for the children 1 to 14. Then the 300 milligram tabs for those 15 and above. Then we also have a syrup, which can also cater for the children who are below 5 years, majorly the PLHIV or even the contacts. But to note, before you initiate IPT, you have to quantify the amount of isoniazid you have in stock. So you start a client today, you have to be sure that their course for 6 months is committed and kept aside. INH is also administered concurrently with vitamin B6 to minimize the side effects. The dosing chart for the 100 milligram and the 300 milligram, you can review. It's according to age band. So INH is given by weight, not by age. What are the common side effects we have to look out for, and what should you do when they occur? They are rare, but sometimes happen. Clients can show signs of hepatotoxicity, like dark urine, unusual fatigue, yellowing of the eyes, the skin, peeling of the skin, pale stools, itching. We need to stop IPT immediately and we review this client for hepatotoxicity, need for a liver function test, and we review to see whether they can continue or they need to be stopped on IPT. Complaints of tingling sensation, burning sensation, and numbness on the feet, on the hands. We encourage them to take the vitamin B6, but if persistent, we double the dose of the B6. For joint pains, we manage with the available analgesics. INH reporting and ordering, just like any other services offered, stock cards and dispensing logs have to be updated whenever INH is issued and dispensed. Align INH refills to client at refills. If the ARVs are for 2 months, you also give INH for 2 months. Routinely update the INH register to ensure that clients complete their course to avoid treatment interruptions which can lead to multi-drug resistant TB development. Committed stock should be excluded from the closing balance when making an order. And routinely on a quarterly basis, reports are expected capturing how many clients were initiated in that quarter, how many were initiated 6 months ago have completed their treatment, and how many are still ongoing treatment. So all these outcomes are needed in the care and treatment report, the cascades report, and the MER. So as a facility newly initiating INH or revamping your INH program, what should be your next steps? You need to line list all the clients eligible for INH and have them initiated on their clinic visits as they come. Provide routine health talks on INH during your clinic visits such that the clients get to know the benefits of INH and the side effects as well, and when and how to manage them. Then it's also important to have the client files easily labeled to ease identification of those you have initiated, those who have completed, and those still ongoing treatment. And in case of any challenges, you can consult for support. Thank you very much for your time, and I wish you well.